You have been maintaining 5 daily habits for decades that endanger your feet. You think the symptoms you're experiencing are due to aging? Not at all. Early signs of poor blood circulation to your feet are warning of danger threatening your legs. And if you're living with diabetes, this can lead to foot ulcers, infections, and even gangrene if not detected immediately. This video is a warning, built on reliable medical research, to help you understand the real causes and how to address them today. Watch now before it's too late. 1. Sitting for long periods without movement, the silent daily harmful habit. Let's be honest, do you spend hours each day sitting watching TV, reading newspapers, scrolling on your phone, or doing crossword puzzles? For many people over 50, this is an essential part of retirement lifestyle. These seemingly relaxing and harmless activities actually paralyze your circulatory system, especially for people with diabetes. When you sit too long without moving, blood flow in your body, particularly to your legs and feet, slows down. The muscles in your legs play a role in pumping blood back to your heart. But if you don't move, blood easily stagnates in the lower extremities, causing swelling, numbness, and loss of sensation. That's the shortest path to diabetic foot ulcers. For diabetics, things are even more serious. Long-term high blood sugar weakens the small capillaries in your legs, making them vulnerable. When circulation is poor, oxygen and nutrients cannot nourish the leg area, making even a small scratch difficult to heal, and the consequences, as you know, infection, gangrene, even amputation. According to research by the American Heart Association, AHA, people who sit more than 6 hours daily have twice the risk of poor circulation and peripheral vascular disease compared to those who move regularly. I understand this habit has been with you for decades. And I'm not asking you to change your entire life, just add a few small actions each day, but do them correctly and consistently. After every 30 to 45 minutes of sitting, stand up and walk around for at least 3 to 5 minutes, walk around the room, stretch, or simply standing up and sitting down in place is enough to activate blood circulation. If you tend to forget, simply set an alarm or use a watch to remind you to move lightly. You can easily get absorbed in a movie or book, so set your watch or phone to remind you to move. This is small, but extremely effective. Try light movement. Moving even while sitting, believe it or not, but it's truly effective. You can try simple exercises like flexing and extending your ankles, rotating your ankles, or gently raising your knees while watching TV. These movements help prevent blood blockage while you remain comfortable in place. A habit of several decades can be changed in minutes if you actively improve. Start now, and you'll see the difference. And don't leave, because habit number 2 is about to be mentioned right after this. You're probably unknowingly doing it every day without realizing. 2. Crossing your legs while sitting, an unconscious habit with serious consequences. Do you often cross your legs when reading the newspaper, watching TV, or chatting with family? This is a familiar position, almost reflexive, making you feel comfortable, polite, or helping you maintain balance while sitting. But for people living with diabetes, this seemingly minor habit is silently damaging the circulatory system in your legs. When you cross your legs, especially for extended periods, blood vessels in the thigh and calf areas become compressed. This restricts blood flow to your legs and feet, causing numbness, cold feet, and even cramps. Blood that can't circulate properly also means nutrients and oxygen can't reach areas that need healing, particularly dangerous if you have small wounds on your feet. According to a study published in Clinical Physiology, sitting with crossed legs for 15 consecutive minutes can reduce blood flow to the legs by up to 40%. And in diabetics, where capillaries are already weakened, that figure could be even worse. More concerning, because this is an unconscious habit, you often don't realize you're doing it until your legs begin to tingle or ache dully. I'm not asking you to sit rigidly or change your posture immediately. But you can actively adjust to protect your feet, in a simple and easy-to-apply way. Start by training yourself to sit properly. Always keep both feet parallel and placed flat on the floor. If needed, you can use a low stool or footrest for support, helping blood flow more easily to your feet. When sitting, don't maintain one position for too long. Rotate your ankles, stretch your feet, or stand up and walk gently every 30 to 45 minutes to help activate blood flow regularly. And most importantly, practice observing yourself. The habit of crossing legs usually comes reflexively, so if you don't pay attention, it will continue to repeat as usual. Therefore, try setting a small daily morning reminder, for example, today I will sit with proper posture for healthy feet. Gradually, you'll create a new, healthier reflex that's safer for your circulatory system. Don't take this lightly. Even a small habit can damage your feet every day. Just paying a little more attention, acting a little earlier, and you're actively protecting yourself from dangerous complications. And now, let's continue with habit number 3, because who knows, the next advice might help you improve your health faster than you think. 3. Wearing shoes or socks that are too tight, small pressure, big consequences. I know that for many people, especially after age 50, we often maintain the habit of wearing shoes we've been comfortable with for many years. Sometimes those shoes are old, the inner cushioning has worn out, but you still think, they're still fine, no problem. Or socks that are a bit snug, but you still wear them for warmth and neatness. But these small pressures are the cause of major damage to diabetic feet. When you wear shoes or socks that are too tight, the small blood vessels in your legs and feet become compressed, preventing blood from circulating naturally to your extremities. For normal people, this might just cause discomfort. But for diabetics, where capillaries are already weakened, it can cause numbness, cold feet, pain due to lack of oxygen and blood nourishment. Especially, loss of sensation in the toes makes it difficult for you to detect scratches, blisters, or skin damage. And more seriously, foot ulcers, infections, leading to severe complications like gangrene. According to the American Diabetes Association, ADA, inappropriate footwear is one of the leading causes of diabetic foot ulcers, accounting for 20 to 25% of hospitalizations due to lower extremity complications. I'm not suggesting you abandon your favorite shoes. But start observing and prioritize comfort, fit, and safety by choosing shoes with a wide toe box that doesn't constrict your toes. The sole should be soft, sturdy but flexible, helping you move easily. Another good tip is to try on shoes in the afternoon or evening, when your feet have expanded after a full day. This is when you'll get the truest size of your feet. Avoid overly tight socks with constricting ankle bands. Instead, use seamless socks or those specifically designed for diabetics, soft, breathable, gently hugging your feet without restricting circulation. If possible, visit a shoe store specializing in diabetic footwear or consult your doctor, especially if you already have signs of foot numbness or complications. The right shoes, the right socks, may not change your style, but they will keep your feet healthy for the long term. Try to actively change your accessories to be more suitable. And right after this, let's move on to habit number 4, an extremely harmful daily habit for your health. 4. Smoking or consuming too much caffeine, the silent destroyer of your blood vessels. I understand the feeling of wanting a morning cup of coffee to start your day alert. Or a cigarette after meals as a relaxation habit many people have maintained for decades. But the truth is, both nicotine in cigarettes and caffeine in coffee are vasoconstrictors, and this is extremely dangerous if you're living with diabetes. When blood vessels constrict, the vessel lumen becomes narrower, making blood circulation difficult, especially to the legs and feet, which are already sensitive due to weak capillaries and damage from high blood sugar. The consequences may not be immediately visible, but over time lead to reduced blood flow, making your feet prone to numbness, coldness, or pain at night. Wounds on your feet heal more slowly due to lack of oxygen and nutrients reaching the injured area. An extremely dangerous, increased risk of foot ulcers, severe infections, and even amputation if not treated promptly. Caffeine in moderation may be fine, even beneficial. But if you consume over 400 milligrams daily, equivalent to 3 to 4 strong cups of coffee, you're making your heart work harder, causing blood vessels to constrict longer, and that's the cause of poor circulation. According to the Centers for Disease Control and Prevention, CDC, diabetics who smoke have a 2 to 3 times higher risk of peripheral vascular disease and foot complications compared to non-smokers. Quitting smoking or coffee immediately is not easy, especially when they've become part of your daily routine for many years. But you don't need to change everything overnight. Instead, start by gradually reducing, smart substitution, and active control. You can start with small, manageable and practical steps, such as, gradually reduce the number of cigarettes each week, and if needed, seek support from doctors or free smoking cessation programs widely available in the U.S. And you can replace smoking with other relaxing activities like gentle walking, deep breathing, listening to music, or calling to chat with loved ones. Good news for coffee lovers, you don't need to eliminate it completely. Actively limit yourself to under 2 cups per day, and choose options with lower caffeine content like decaf coffee or herbal teas which are easier to find and taste better than you might think. Don't forget to drink more water when consuming coffee, because dehydration also makes blood thicker, slows circulation, and increases the risk of blood vessel blockage. A familiar cup of coffee. A morning cigarette. They seem harmless, but they're silently becoming culprits affecting your health. If you actively make changes now, you're not only protecting your feet, but also reducing dependence on medications, avoiding enormous medical costs waiting ahead. And now, let's move on to habit number 5. I'm sure you won't expect this habit. I'll share it with you right away. 5. Not checking your feet daily, a seemingly small task, yet the key to saving your feet. Sounds ridiculous, doesn't it? Checking your feet daily, something that seems unrelated to controlling diabetes or improving blood circulation. But in reality, this is one of the most important habits helping diabetics prevent foot complications. When living with diabetes, sensation in your feet and toes gradually diminishes due to damage to nerves and small blood vessels. You might have a scratch, a blister, or even a deep cut without feeling pain. And of course, you won't notice or treat it promptly. And by the time you discover it, it's too late. You might walk all day with a tight sock, a small pebble in your shoe, or a scratch from bumping into the bed, without knowing your foot is being damaged. And that creates conditions for bacteria to attack, wounds to become infected, gangrene, and finally losing your feet. According to the American Diabetes Association, ADA, up to 85% of amputations in diabetics start from just a small wound on the foot. If detected early and treated properly, they could be completely preventable. Treat checking your feet daily like brushing your teeth and daily hygiene. Each morning or before bed, take 1 to 2 minutes to carefully examine your feet, between toes, heels. Are there any swollen, red, scratched areas, or unusual discoloration? If your eyesight is poor or it's difficult to bend over, use a mirror to examine the soles of your feet, or ask a family member to help check. The method is to touch gently and observe reactions. Is sensation even? Are there any areas with loss of sensation or unusual sharp pain? If you detect any wound, even small ones, treat it immediately by cleaning, keeping it dry, and monitoring daily. If after 1 to 2 days the wound doesn't improve, don't wait, see a doctor immediately. A simple habit, easy to implement, just requiring a few minutes each day to actively care for your health. If you're already practicing this habit well, continue maintaining it. If not, start today. The 5 habits you just heard about aren't anything too unfamiliar. They're familiar, unconscious actions that have followed you for decades. But for diabetics, these habits are the culprits, preventing blood from circulating properly to your feet, causing numbness, ulcers, and other dangerous complications. The good news is, you can definitely change. Just recognize, adjust little by little, and maintain better new habits every day. Start today, for healthier feet tomorrow. And don't forget, my channel has many more useful, easy to understand, and easy to apply information specifically for diabetics. Keep following upcoming videos because your health always deserves proper attention, every day.